go through some of the questions you've kindly sent in. And I think one of the things that's been quite big, it's been quite heavily publicised in the news, is some changes to the way that people can access weight loss medication, and mostly the injections. So the injections have or a weight loss medication for that you inject to help you lose weight have been around for a while. Actually, it started off in about 2017 or really 2015 when Saxenda came to the market, the first injectable weight loss medication. It's very rarely used now, but Saxenda is still around. But more recent, you know, with Wegovy coming to market and most recently Mounjaro, lots of people have been very interested in this medication. The results of weight loss with taking these medications, both in the clinical studies that are done before a drug comes to market and also in real life, people's experiences have been brilliant. You know, there's some fantastic weight loss results that can be achieved. And that's meant all of a sudden there's been a variety of ways you can access and get that medication. Now, these are prescription medications. So that means a prescriber, you know, a suitably qualified and trained prescriber should assess you and assess information about you, your health, any medical conditions you may have now or have had in the past, as well as any medications you're taking, to then prescribe it for you. So they always need the oversight of a prescriber. But what's happened recently is there's been a lot of online pharmacies and online options for sourcing this drug. And what they're using is, instead of you having an appointment with a clinician through a video or submitting lots of types of evidence with your online request, some of them are simply using just a form, which means that obviously you go on, you enter your form, and the vast majority of us would be honest and would, you know, would be, you know, truthful about our medical health and our weight, etc. But there have been instances when people who maybe shouldn't have sourced this medication have managed to, and that's people with things like a history of eating disorders who it really wouldn't be safe for them to take this type of medication. So what that means is that the General Pharmaceutical Council, who regulate pharmacies and how pharmacies, you know, work and behave and the practices, have said actually a form fill without any validation of people's medical health or their weight and their appropriateness for the drug isn't suitable anymore. So there needs to be far more robust ways for checking that somebody is correct and safe for the drug. I mean, that's the key. That's why we you know, do as clinicians, that's why we assess you, is to make sure it's safe and right and you're going to get your best results from taking the medication. So, you know, some people are saying, well, what does that mean for us here at the Slimming Clinic? Because we have two options. We have a appointment-based option, which we've been doing for years. You know, that's been the bread and butter of what we've done for many years. Is you have now a virtual appointment with a doctor, with a clinician, and we have longer ones where people want to really dive into their diet and lifestyle alongside the medication, and we have more shorter ones for those who maybe have got a busy lifestyle and just want to sort of, you know, just jump in and have the core elements that they want to talk to the doctor about with regards to their medication. So with those types of appointments, you do fill in a bit of information before you attend, then you come to the appointment, you speak with the clinician, and then you get an instant decision on the drug that's suitable for you. The doctor can let you know there and then what medication is the best one for you, and if you're happy to go ahead, you know, your prescription can be authorized there and then, and hopefully on its way to you even the same day if it's in time for our pharmacy to post it out. But there is also the online option. Now, there's no change to the way we do that because we are a CQC regulated service. So we're not an online pharmacy, although we have our own pharmacy. We're actually a CQC regulated weight loss clinic. So the way that we have to assess our patients is obviously robust because we're inspected by the CQC. They're going to make sure that we're working in a safe manner and that we've got the right checks and balances in place to ensure that we're delivering a good and safe service to the public. So what that means is where we have our online prescription requests. So, you know, you're going on to request the medication you would like. Yes, you do fill in some information yourself, but then we make you submit lots of pieces. I'll say lots of pieces, that makes it sound like it's exhaustive. A few pieces of information that help us validate you are who you say you are. So some sort of ID evidence, something that we can see that it's you, and we can see you know, a full-length picture or maybe even a video of you, so we can see your sort of size and frame, as well as maybe taking your weight measurement as well, so we can check elements of that. And also we try as much as possible to have an open dialogue with your GP. Now, I touched on this last time, this is private sector to medication, so we will not automatically inform your GP, but we do discuss it with you, and we have a short video for those patients that wish to request online to understand why we prefer to let your GP know. And again, that creates a two-way dialogue as well, so we can ensure that the medication is safe and appropriate. So to answer that question that someone said in, what changes that to what we're doing at the Slimming Clinic at the moment, there is no change. You can continue to interact with us in the way you do. Now, I'm a doctor, so if you ask me, I'd say come for an appointment so that we can, really get to know you and understand your health and, the goal you want to achieve. And, we can give you far more tips and advice on how to make some changes alongside the medication to get your best results. But, the world is changing. People are busy. People want to be able to, look at stuff in the evening when they're winding down from work, or the children are going to bed, or you're sitting there. So, we absolutely understand that. So we're trying to, ensure the service can be as convenient for you as possible, alongside making sure that we've got the medications that our prescribers are happy to, that we've received everything we should have to know that we can prescribe for you correctly and safely. So you can still get your medication, but I would advise you, whether you're a patient of ours or not, to go for a service that is robust, that makes sure that the medication is correct for you. And we may see a change. Some of these online pharmacies might change what they're doing, and you never know. More and more appointments with clinicians and prescribers would be great.